Hello everyone, and welcome to this instructional video on the MacHAND Performance Assessment short form. My name is Zoë Edger-Lacoursière. I am an occupational therapist from Montreal, Canada, and a PhD student at McGill University in the Rehabilitation Science program. So in this video, I will be going through the origin of the MPA-S, or the short form of the MacHAND, then the goals and properties of this assessment and advantages of this measure. We will then go through the different items needed in this test kit, followed by the scoring guidelines and interpretation of results. I will then discuss some important considerations specific to the MPA-S and finish with video demonstration for each task in this test. So the MPA-S was created by the Burn Unit Clinical and Research Team at Villa Medica Rehabilitation Hospital in Montreal. It was created from the full MPA, who was originally created in 2010 by two Canadian occupational therapists, Dr. Tara Packham and Pam Ball. In 2023, translation to French Canadian was then completed by myself and the Burn Unit Clinical Team at Villa Medica Rehab Hospital in Montreal. Finally, the link to the MPA-S Instruction and Scoring Manual PDFs are now publicly available, and the URL link can be found in the description section of this video and at the end of this presentation. So the goal of the MPA-S is to evaluate hand function, more specifically the ability to do daily function tasks with the hand. It was developed for individuals aged 16 years old or older who present with any type of hand injury, condition, or impairment. An initial pilot study by Packham and colleagues investigated the measurement properties of the full MPA, but psychometric testing is currently ongoing for the short form. The instruction manuals are currently available in English and French Canadian. Another instructional video on the full form, the MPA 2.0, is also available on YouTube. So what are the advantages of the MPA-S compared to other hand function measures that are used in our profession? Firstly, when comparing the available performance-based outcome measures of dexterity and hand function, a scoping review by Young et al. Revealed that 20 of these tests exist. Out of these 20 tests, only 7 measured hand function based on the ability to perform daily function tasks, and out of these 7 measures, only 2 incorporate a rating system that quantifies the quality of the movement patterns and calculates time to complete certain tasks. These 2 tests are the MPA and the Solomon hand function test. These 2 measures were also the measures that addressed the largest number of domains from the International Classification of Functioning, Disability, and Health, better known as the ICF. 13 ICF codes for the MPA and 12 for the Solomon hand function test, which really emphasizes how the MPA is anchored in real-life activities. Although the full MPA was in Young et al.'s scoping review, the short form is based on 10 tasks from the full form, meaning it also includes many ICF domains. The MPA-S also includes a task that measures the ability to perceive and recognize objects without seeing them, or known as pterygiognosis, which is quite pertinent for the traumatic hand injury population due to the high occurrence of sensory impairments. Importantly, the MPA-S is also based on common hand grasp patterns and includes all 6 grasp patterns identified by Young et al. Since the MPA-S was recently created, the tests are not outdated. Some tests still have tasks such as writing a check or using a telephone receiver, which are currently a lot less common than using a smartphone or manipulating a power plug. Finally, the MPA-S can be assembled with objects that are available anywhere in the world. The instructions are freely accessible, and it is a low-cost test. Some components are even 3D printable to reduce cost. The short form takes only 10 to 15 minutes to administer, which is extremely advantageous in a busy clinical setting. So now we will do a quick list of the different items needed for this assessment. These items are everyday objects that can easily be found in Canada. If they are difficult to find in your country, the specific dimensions of each item can be found in the MPA Instruction and Scoring Manual PDFs, so you can find similar items. The logo on the top left corner of the slates image indicates that this item can be 3D printed to increase the standardization of the test. We always encourage you to use the 3D printed versions of these items when possible. The link to the 3D printable files can be found directly on the MPA-S Instructions and Scoring Manual PDF. So you will start with needing a stopwatch, a 1 kilogram Kraft peanut butter jar with marking, and 3D printed or styrofoam slates with specific dimensions. Then, you will also need 3D printed sensory items, or the equivalent of 1 Canadian penny and 1 aluminum washer similar in size to the penny, 1 standard metal paper clip and 1 safety pin similar in size to the paper clip, 1 1/8 inch square nut and 1 1/4 inch hex nut, 1 1 inch long wood screw, and then you will need a Papermate ballpoint pen, a 2-prong indoor extension cord of type A or the most commonly used extension cord in your country, and finally 10 3D printed Canadian dimes or 10 Canadian dimes. You will then need two 2-liter plastic jugs with markings, which are indicated in the instruction manuals, a 3-quart stainless steel saucepan, and 3D printed buttons sewn onto fabric like a shirt on a wooden frame, or buttons that match the specific size requirements. Then you will need a Corelle cereal bowl, half a cup of dried navy beans, and a regular soup spoon. Then a 900 milliliter box of soup broth or other liquid, a 1.8 kilogram of dishwasher detergent, a melamine or wooden open box with 10 centimeters and 15 centimeter markings on the side, fabricated with the dimensions specified in the instructions manual. You will also need a visual analog scale to assess pain. This can be printed and assembled using the instructions and diagrams in the appendices of the MPA-S instructions and scoring manual PDF. Finally, a 30 centimeter masking tape parallel to the edge of the testing table at exactly 10 centimeters from the edge, and 2 other tape pieces at 45-degree angles from the table, both at the right and left sides. When scoring the MPA-S, there is a general scoring guideline presented at the beginning of the instruction manual, which is shown here, but some tasks also include specific details which are in addition to this guideline. Generally, a score of 5 represents a perfect score, and a score of 0 is when a participant cannot perform any part of the task. The participant is always asked if the task produced pain, which is scored with the visual analog scale, and the score is then appropriately adjusted. The MPA-S is scored out of 50 if the tested hand is the dominant hand, and out of 40 if the tested hand is the non-dominant hand, with higher scores that represent higher levels of hand function. So before diving into the task demonstrations, I just want to go through some important considerations for this test. Number 1, the tested hand should be determined before doing the assessment. Number 2, if the participant has amputations, the score is not affected by the fact that they have missing fingers. The assessor should score with all available digits. Number 3, adaptive equipment can be used but should be determined before doing the assessment. Number 4, when indicated, the assessor can stabilize items for the participant. Number 5, the MPA-S can be used for prosthetic training in the clinical setting, but not all tasks will be able to be completed with all types of prosthetics. And finally, number 6, the text in quotation marks must be read out loud before each task. Okay, so now we will look at videos of each task and I will describe what they involve. Before starting the test, it should be introduced with this statement. This test is designed to look at all of the different ways we use our hands to grasp and pinch for everyday activities. You will be asked to do 10 different tasks, or 8 depending on the tested hand, and you will be given specific instructions for each task. Let me know if anything causes you pain, and it is okay to tell me if you need to stop at any time. This first task is performed standing up if the patient is able to do so. The patient will need to pour half of the water from the first jug, which contains 1 liter of water, into a saucepan, and then put the water from the saucepan back into the jug. The patient then does the same thing with the second jug, which contains 2 liters of water. The assessor's focus is on the power grasp, pronation, supination, coordination, and endurance. We recommend having a towel close by since some water always tends to spill on the table. The person is only penalized for this if a large quantity of water is spilled. The second task consists of opening and removing the lid of a peanut butter jar with the tested hand on the lid and the non-tested hand stabilizing the jar, and then putting back the lid back on the jar until the indicator line. The assessor can also stabilize the jar if needed. If the patient is unable to open the tightly screwed lid, they are asked to retry once the assessor loosens the lid slightly. The assessor's focus is on the hand manipulating the lid, performing spherical grasp with elbow flexion. This next task asks the patient to pull out and put back in a plug in a socket. The non-tested hand stabilizes the socket, but this can also be done by the assessor. The assessor's focus is on the hand manipulating the plug, performing lateral pinch. This task asks the patient to pick up 10 3D printed Canadian dimes or regular dimes and then to keep them in their hand until all 10 are in their palm. The coins that are 3D printed should all be placed on the same face, on the table. The assessor's focus is on the pad pinch with dexterity and in-hand manipulation. The participant should not slide the coins off the table when picking them up. Task 5 asks the patient to unbutton the top 3 buttons and to do them up again. There are more buttons on this shirt so that the orientation of the buttons matches that of a man or a woman's blouse. For example, the buttons on a man's blouse are on the right side and on the left side for a woman's blouse. The assessor asks the patient what type of shirt they usually wear before the task is performed, and the board is then flipped accordingly. The buttons of specific size for this task can also be 3D printed if they are difficult for you to find. During this task, the assessor can stabilize the board, which is placed in front of the patient like a shirt. The patient can also stabilize the shirt with the untested hand, but this cannot be done by the assessor. The assessor's focus is on power pinch and dexterity of the tested hand. In the MacHAND short form, task 6 is only completed if the tested hand is the dominant hand. So for task 6, the assessor needs a stopwatch to time the performance. The patient is asked to copy the symbols from a printed test paper as fast as possible. The assessor's focus is on the tripod pinch, fine motor, coordination, and endurance. Once again, in the MPA-S, the task 7 is only completed if the tested hand is the dominant hand. So task 7 asks the patient to scoop up about 10 navy beans using a soup spoon and bring them near their face as if they were to take a bite and to put them back in the bowl. The assessor's focus is on lateral pinch, supination, and elbow flexion extension. If some beans are dropped, points are only deducted if it is a majority of the spoon's contents. For this next task, the different objects are presented to the patient by the assessor to familiarize them with their names. If the person being tested has difficulties with language because of cognitive or linguistic concerns, a second set of objects can be used for the subject to identify by pointing. The patient is then asked to close their eyes and to pick up one object at a time from the bowl and to name it and drop it on the table. The assessor should not say yes or no to indicate if the patient is correct. The assessor's focus is on dexterity, sensation, and stereognosis. The patient should not slide the object on the sides of the bowl when picking them up. We strongly encourage you to 3D print these items as some of them are very difficult to find, like the square nut. This next task asks the patients to pick up slates with their thumb and designated combination of fingers and then put them back on the table. This is mentioned at the beginning. Slate A with index, B with middle, C with ring, and D with small. The slates are placed on the tape line on the table with the smallest one closest to the tested hand. The assessor's focus is on the span. For this last task, the patient is asked to lift the small box on the table on the top of the shelf and put it back on the table. They are then asked to do the same thing 3 times with a bigger box. The assessor's focus is on lumbrical grasp with functional reach, shoulder flexion, extension, and endurance. If the patient uses the other hand to support the object, this automatically gives a score of 1. So here are some of the references from this video. So there is the reference for the original pilot study on the MPA and the scoping review by Young and colleagues on performance-based outcome measures of dexterity and hand function. There's also the links for the PDFs of the different available versions of the instructions and scoring manuals, which are here and in the video's description. The Thinkiverse links to the 3D printable items is also available here. We would like to acknowledge our sources of funding for this project, which are la Fondation des Pompiers du Québec pour les Grands Brûlés and the Réseau Provincial de Recherche en Adaptation Réadaptation. We would also like to thank the clinical team and our patient partners who were involved in this project at Villa Medica Rehabilitation Hospital. If you have any questions, please feel free to contact me or Professor Nedelec by email with the email links on the screen. Thank you very much for watching.